And here is your question. Okay, so if you have read and understood, considering it history taking station, please begin.
Good evening. My name is I'm candidate number 2, and I'm here to uh, ask you a few questions about your condition. May I know your name and age, please?
Yeah, good afternoon. I am Dr. I am Ahmed. I am 33 years.
Okay, Ahmed. Thank you for telling me your name and age. Uh, I want to ask a few questions about your condition. Is that okay with you?
Yeah. For that I came to you.
Okay. So, Ahmed, tell me what has been bothering you?
Look, doctor, since 8 months, I noticed some swelling in my groin, right groin, and
Okay,
I don't know why this one is becoming bigger now.
okay. Which side is it, Ahmed, if I can know that?
On right side only.
Okay, right side of your groin. Okay.
Yeah.
Uh, can you tell me how it started?
It started since 8 months. I notice it
Okay,
when I take a shower. There is a swelling in my groin.
okay.
Yeah, that
So,
every day I notice when I am lifting an object or during my training in gym.
okay. So, has it been increasing in last 8 months or it has remained the same?
Now it's remained the same since eight
Remained the
months.
same. Okay. So, uh, so the swelling is the same, or it decreases in size, or how is it like? When
It's
you-
it's previous. I was pushing it back. It's become reduced, but now
Okay,
it's very painful when I want to reduce.
okay. So, are you able to reduce it now, or you're not able to reduce?
Yes, I can, but it's very painful.
Okay. So, any particular thing which increases the swelling? Any particular activity or
Yeah,
something?
I noticed that it's increasing when I am lifting something or I am do training in the gym.
Okay.
I am a gym trainer.
Okay. Thank you for confirming your occupation, Ahmed. Yeah. So, any increase while straining for stools or any increase while cuffing?
Yeah, sometimes yes.
Okay. And uh, doing what reduces it? You are able to reduce it on its own, and
When I
anything
am
else?
lying back, it's reduced, or when
Okay.
I push it by my hand.
Okay. Okay.
Yeah,
So, you also told that recently you've been having pain. Is it?
yeah, yeah.
Yeah. Okay. So, how severe is the pain on a scale of 1 to 10?
6/10.
Okay. So, 6 over 10. 10 is the maximum pain you've ever
Yeah,
had.
yeah, yeah, yeah.
Okay. Any fever you're having with it?
No fever. No,
No fever. Any change in your bowel habits?
no.
No. Okay. Any recent loss of weight or anything like that you're having? Loss
No,
of appetite or loss of
no, no,
weight?
no, no, no.
Okay. Any other similar swellings anywhere else? In the right,
No,
left side, or near your
no,
belly button,
no,
anything like that?
no, no.
Okay. So, Ahmed, do you mind if I ask you a few personal questions?
Yeah, no problem.
Okay, okay. So, you already told you're a gym trainer. So,
Yeah.
can I know, do you smoke?
No, I am not smoker.
Okay, okay. So, can I know whether you have alcohol or not?
No, I didn't.
Okay, okay, very good. Uh, can I know whether you are using any stamina tonics or anything like that?
Yeah, I use some
Okay,
stamina tonics every day
okay, okay,
for muscle build.
okay. So, have you visited gum clinics recently?
Yeah, a few weeks I visit a gum clinic for infection during
Okay.
week.
So, any tests you have done for any infections like HIV or anything like that?
Actually, no, just for this urine infection.
Okay, 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 okay. So, uh, any similar swellings in the past before?
No, no,
Okay. Any other like medical conditions you have, like sugar or BP,
no,
hypertension or something like that?
no,
Okay. Anytime before have you been admitted to hospital or hospitalized?
no, no,
Okay. Any allergies for any medicines you have, Ahmed?
no,
Okay. Okay. So any similar complaints in your family or any family member who has had a similar complaint like this?
no.
Okay. Okay. So, uh,
Okay.
so
Can you please
I,
summarize your
yeah.
history now?
Summarizing my history, here is a 33-year-old gym trainer, Ahmed, who
Yes.
is presented with right-sided groin swelling since 8 months. It has slowly, gradually increased to its present size. And at present it is also painful. On severity of the pain, it is 6 to 10. There is no change in bowel habits. It increases on coughing. He's able to reduce the swelling by himself or while lying down uh, until recently. So
Okay.
he has also had a history of uh, genitourinary infection, and he has visited gum clinic. He has also taken stamina tonics.
Okay.
Otherwise, no significant past medical history or family history or no drug allergies. So
Okay. So what would be your differential diagnosis?
my differential diagnosis, right-sided groin swelling, 8 months duration, now presently painful. My first differential diagnosis will be inguinal hernia.
Yes.
Um Other diagnosis probably could be a groin abscess
Okay.
or lymphadenopathic swelling.
Lymphadenopathy. Yes. Okay. Do you think, what do you think, how does hernia takes place or happens?
Hernia can happen by two ways, either direct, that is through the defect in the abdominal muscle wall, Hasselbalch
Yes.
triangle, or
Yes.
indirect via patent processus vaginalis.
Okay. Do you think patient's condition could get better
It is unlikely that patient condition will get better
on
unless,
itself?
yeah.
Yes. So what would be the procedure that you can offer him?
So I would like to offer him reduction of the hernia and repair of the defect
Yes.
with a mesh hernioplasty,
Yes. Yes. Open
open
or keyhole.
or laparoscopic. Yeah.
What are the indications for laparoscopic hernia repair?
I don't know, ma'am.
Yes, if in exam situation like this comes, then you can say I'll come back to this question later. Okay, can you please tell me when do you think, since the patient you said is gym trainer, when the patient would be fit enough to go back to work?
Patient will be fit enough to go back to work maybe in 3 to 4 weeks, 1 month
In
time.
2 weeks. Yes,
Yeah.
to be average, yes. All right. If time would have allowed you, how would you have completed your history?
Yeah, if time would have allowed me, I would have completed the IC part. I would have asked his like what does he think the diagnosis is, what is his main concern, and what does he expect out of the treatment.
Yes, he cannot think of diagnosis. He can only tell you about his idea. I for idea, right?
Yeah.
Okay, this and right. And from my side, time has gone, but I would say that you could have asked about the swelling size, how big patient think the size is, right? And what about if there is any changes on the overlying skin, if there is
Okay.
any wound or sore or over the bulge, if there is any discharge, if patient hears any sounds coming out from that bulge, right? These are and if patient, because here patient denied any straining during defecation, or if patient complained about any mass or distension of abdomen because of that. But normally this sort of condition occurs because of straining. If not because of the cuff, then patient definitely has some sort of constipation history long term. Good, thank
Yes.
you.